Hello, I am Dr. Shashikiran from AASRA here. I am a minimal access surgeon. I finished my super specialization from AIMS New Delhi. I am a specialist in thoracic and GI surgery and all kinds of minimally invasive general surgery. My expertise is mainly in thoracic, especially minimally invasive, that is video assisted thoracoscopic surgery, and we are starting with robotic assisted thoracoscopic surgery at AASRA now. I am well trained in thoracic surgery and GI surgery. I have assisted in more and operated total of more than 1000 surgeries by myself, with a experience of more than 10 years now after my graduation. I have performed and assisted a total of around 300 thoracic surgeries, mainly video assisted thoracoscopic surgeries, and around 50 to 60 robotic assisted thoracoscopic surgery at AIMS Delhi. The advantage of using a robot in thoracic surgery, that is in the chest cavity, is that it is very precise, because the area in which we are working in chest cavity is very small, and there are very large vessels there in the chest cavity, which has to be dissected very precisely. 3D vision that is provided by the robot gives us the depth perception that is very much important in the chest cavity, so that we are minimizing the injury to the surrounding tissues, and which in turn leads to less complications. We can perform a lot of complex surgeries with minimal complications using the robot. So the things that we can take care by using robotic or minimally invasive surgery in the chest cavity, or the diseases related to lungs, like tuberculosis of lung, especially aspergillomas, and bronchiectasis, where patients can have recurrent hemoptysis, that is blood in the sputum. And you can also take care of other problems related to the chest, that is the thymomas or myasthenia. In patients with myasthenia gravis, you can remove the thymus using minimally invasive methods, especially robotic. Even larger tumors can be handled with minimally invasive methods using the robot. And we can also take care of other common disorders like hyperhidrosis, that is excessive sweating from your palms and soles, and any lesions in the lung, like if you are planning to do a small biopsy, or patient is having recurrent pneumothorax, that is air filling outside the lung leading to collapse of the lung, which can be seen in many patients which go undiagnosed. These can be taken care easily by minimally invasive methods. And the other important things, common things that are taken care by minimally invasive methods, are the empyema of thorax, that is pus filling around the lungs, which is very common condition in our country, especially because of tuberculosis, which is rampant everywhere in India. So these are the things that we can do with minimally invasive methods. We can do video assisted thoracoscopic surgery and as well robotic assisted thoracoscopic surgery with minimal complications. If you are looking for procedures related to lung or lung related disorders, AASRA is the place that you can come to, and we can assure you that we can give you the most advanced treatments that are available in thoracic surgery and GI surgery as well, and with minimal complications. We also can take care of cancers in the cancer related diseases like cancer of the lung with minimally invasive method, and also esophageal cancer, which is very difficult to do. I mean, it is a morbid procedure if you do it by open method. If you are able to take care of it by minimally invasive method, either video assisted thoracoscopic surgery or robotic surgery, it is always leads to a faster recovery, even in a major surgery like esophagectomy or in lung cancer resections. If you are looking for surgical care related to chest cavity or gastrointestinal disorders, we are here for you.